I'm a family practice, board certified. I've been working here in Huntsville for about 15 years since graduating from residency. I see basically infant to death. I see the whole gamut of patients in my practice. I started doing a little bit of it at the very beginning, just maybe 1 or 2 patients a week, starting to learn what pharmacogenetics was about, because I thought it was very interesting information that could possibly affect my patients and maybe change the course or the direction of management of my patients in the future based upon the knowledge that I got from the test. The first challenge was taking the time to relearn what we learned back in med school, which GenoPATH made that fairly simple because of the way they formatted their test design. We didn't just get a report of results. We got what medications the patient was on. We had a pharmacy review of medications. We actually had options of medications that could be used if a person was a poor metabolizer or a rapid metabolizer. So it made the learning process a steep curve. It made it easier. It probably took a good 2-4 months at the most before I knew, as soon as I saw a medication, what its metabolism was, whether it was going to affect my patient, whether it was a good drug to prescribe. So there definitely is a learning curve to it. But fortunately, I picked the right company to go with to help make my process easier, because us as physicians don't have much time to do all these extra things. And as a primary care doctor, now that I see and now that I understand these tests that have been done, I've been able to make changes on those patients to improve the outcomes of their management and actually reduce some side effects of the medications that they thought maybe this fatigue was, just the fact that I've been working too hard, or, maybe I'm not sleeping well. Come to find out, if they're a poor metabolizer of a certain medicine, they're fatigued because of the medication, not because they're not getting enough rest. And so many times I've taken people off of certain drugs, particularly beta blockers, Toprol being one of the most commonly prescribed medicines out there as a beta blocker, and I would say over 40-something% of people are poor metabolizers of 2D6. You take them off that medicine and you change them to a different beta blocker, all these people who need to be on beta blockers for heart disease or heart failure. And I've been amazed at the improvements. They're not coming back saying they're tired and fatigued, but yet you're still treating their symptom and disease process. It has definitely made a change in my practice. Yes, I do. One in particular, a history of this patient. Ever since his teenage years, he's had extreme chest pain, epigastric pain. He's been to the ER many times. He's been scoped many times. Actually had a catheterization done on him. And come to find out, due to the fact that he is an ultra-rapid 2C19 metabolizer, they require up to 200% of the recommended dosage to treat their symptoms. So this guy's been going in with dyspepsia that doctors give him these proton pump inhibitors over and over again at the maximum dose, and it wasn't doing him any good, so he starts thinking it's cardiac, and every time he goes to the hospital, and I sit back and I think of all those tests this one patient had that could have been stopped if we just would have known how he metabolized that particular medicine. And ever since then, since I got the report, we bumped up his dosage of that particular medicine, and he's been symptom-free since adjusting that. Now, interestingly, he was also a poor 2D6 metabolizer, and he was on Toprol, so I had to make some adjustments on his beta blocker as well. They put him on a beta blocker. I would say that's probably the most memorable, but there's still quite a few different things in my practice I have seen and that I've learned through this genetic testing that have changed the way I practice medicine and actually benefited the patient and more than likely reduced admissions, or if I would have had the information beforehand, I could have reduced some of the admissions. I wish I could have this test done on every single person in my practice from birth up, because once you do it, you know it. And therefore, in the future, I always know what drug to prescribe for my patients. In the long run, at least I feel like it leads to better patient care once you realize the the differences in people's metabolism of medications.